Thanks for listening. I'll continue this video on sleep, and I'll also talk about the other organs, our brain, sensory organs that our brain is connected to. Okay, so for sleep, right? One sleep cycle is 90 minutes. So we will have, so in our period of sleep for, let's say, 7 to 8 hours, we will have 4 to 5 sleep cycles a night, a full sleep cycle. So a full sleep cycle consists of the non-REM, non-rapid eye movement stages, and the deepest part will be the REM, the rapid eye movement stage. So non-REM occurs in stages that leads to REM. This non-REM is a deeper, restful state of sleep, whereas in REM, it is an active part of sleeping, which is why the REM stage is known as the paradoxical uh, part of sleep. Okay, so I'll explain the stages. So in sleep stage occurs with N1, it is a light sleep stage where we move in and out of consciousness. Then in N2 stage, the second stage, is when our body temperature falls, our heart rate slows down, breathing becomes shallower, and minor noises will not wake us up. So that's where sleep spindles happen in our brain activity. Then from N2, we progress to N3 and then N4. So in both N3 and N4, which is actually a progression of sleep stage, our both in both stages, our breathing reduces even further, heart rate drops even further, our muscles become relaxed. We go into deeper sleep. And in this stages, it is hard to wake us up. And then this is where delta waves will be produced. So in N3, that's when sleepwalking happens as well. And sleep disorders happen in these stages, 3 and 4. Then finally, we'll move on to REM stage, where the paradox is our brain is very active in this stage, but our body is inactive. So dreams can happen during this stage. Then in sleep disorders, there are cases such as insomnia. Insomnia is difficulty sleeping. Sleep apnea is a medical condition where our breathing can periodically just stop for more than 10 seconds. And such a person will have choking and gasping because the breathing is affected during the sleep. Then in narcolepsy, it is where a person cannot control their sleepiness during the daytime. They can suddenly just fall asleep and sleep for 5 minutes or to 30 minutes duration. So they cannot control it. Yeah, so that's narcolepsy, that's a sleeping disorder. Then night tremors is when a person is aroused and terrified in the N3 stage of sleep. So it's different from nightmare. The person will seldom remember what has just happened in the night terror. Then in REM behavior disorder, it is when a person enacts the dreams out. That means while they are dreaming, they actually suddenly have suddenly have violent arm movement or leg movement during the REM stage of sleep. During this such cases, the dreams are often unpleasant. They can also produce sounds when they are in this stage. So moving on to psychoactive drugs, they can have an effect on our body. So there are different kinds of psychoactive drugs. One category is called stimulants. Stimulants can be things like caffeine, nicotine, cocaine, and amphetamines. So caffeine can cause addiction and high blood pressure. Nicotine in cigarettes can cause addiction and cancer. Cocaine, the drug, and amphetamines both can cause addiction, stroke, heart problems, and psychosis. So it affects the brain. Then, in another category of psychoactive drugs called the depressants, there are things like alcohol, benzodiazepines, and barbiturates. Alcohol can cause alcoholism, depression, accidents if they're drunk driving, and can cause death. Benzodiazepine will just cause overdose and addiction, whereas barbiturates can cause addiction, brain damage, or even death. Then in the third category called narcotics, these are things like opioids, which can cause addiction or and death. In the fourth category called the hallucinogens, these are stimulants like LSD, PCP, MDMA. Halogens can cause permanent memory problems, suicide, overdose, and death. Then marijuana is a category by itself. It is a cannabis. Marijuana, it can arouse appetite, affect the well-being of a person, affects the brain as well. Yeah. The effects of psychoactive drugs can be affecting our physiology and cause addiction. So in physiology, it can damage the neurons of our brains, impair learning and memory. It can also uh, lead to increased tolerance and resistance. So we'll need more of it to sustain the habit. Then when a person withdraws from it, there will be withdrawal symptoms. Okay, now on the topic of sensation and perception, these are two different things. So sensation will be our sensory receptors, let's say our hand, our eyes, our hearing, our five sense organs. They will actually get the input from the surroundings and then send the information to our nervous system, where our nervous system will then convert this information into an electrical impulse to send to the brain for processing. So perception, on the other hand, means how we organize and interpret this sensory information. So let's say we have our eyes tell us that it's so bright here. Then our when our brain has received this information that is so bright, then our brain will then have need to interpret this and perceive the information and tell us what to do. So this is perception. So in sensation, um, there are different things that can happen. So habituation means that it's a tendency to get used to a constant, unchanging information so that our brain can focus on what is the important thing. So for example, let's say the aircon noise is so constant, it keeps generating noise. It's an unchanging information. It's just there, continuously producing the aircon noise. So our brain will get uh, uh, habited uh, to it so that let's say I'm studying, then I can focus on studying and just ignore the background echo noise. That's habituation. Then sensory adaptation is different from habituation. Sensory adaptation means we have reduced sensitivity to an unchanging constant stimulation. So an example is perfume. So for a person who regularly puts on perfume, our sense of smell will just be desensitized to the smell. And then we eventually need to put more and more perfume in order for our nose to get a stimulus that of the smell of the perfume. So that's sensory adaptation, just gets numb to that sense stimulus. Then sensory deprivation is the other hand. It's opposite. It's where where's absence of normal levels of sensory stimulation. So we deprive that sense. So an example may be like sugar. So say I deprive myself of sugar, then suddenly I can have a rage that I feel like eating sugar, having something sweet. So that sensory deprivation, when we deprive that sense organ of something. Then sensory overload is also different, opposite again. Overload means that um we it is we overload our sense with something. So this is managed by selective attention. Uh, but we can also deprive us of the information. So like let's say I'm driving and then I'm texting. So this this is a case where it causes danger. Yeah. Okay, can. Then I'll move on to the visual system. The eye. The eye. Okay, start with the cornea. It blends light wave to focus an image on the retina, back of our brain. We, then we have got the aqueous humor. Aqueous humor is a clear liquid to nourish the eye, the eyeball. Then the iris muscle. Iris muscle, uh, iris muscle are muscles that control the pupil size. The pupil is the one that dilates and becomes narrow, depending on amount of light. So the pupil is an iris opening. So it adjusts the size, big or small, depending on the light available. So the muscle is iris and the pupil is the opening. Then we have a lens. The lens will change shape for object to focus. So it can become flatter or wider. Then we have got the retina. They are photoreceptor cells along the eye. So the fovea, which is the more back part of the eye, it has got the highest photoreceptors. It's the where the central retina is. Then the optic nerve at the end of the eye area, they are the ones that sends visual information to the brain. So in this part, right, there is a blind spot. This is where optic nerve leaves the eye and there's no photoreceptor cells here. So when we are driving, that certain angles, there's a blind spot. So that's why we must turn and see. So this is the reason. No photoreceptor cells there. Then there is also in the main part of the eye, there is vitreous humor. It is a jelly-like liquid to nourish and shape the eye. So the visual receptors will send signals to ganglion cells, and they are the ones that will send signal to the optic nerve. Okay, that's about the eye. So for the hearing system of the ear, we've got the outer ear, which is the eardrum and our canal. Then the middle ear will be our hammer bone, anvil bone, and the stirrup bone. Inner ear will be the cochlea. So the hearing receptors consist of hair cells in the basilar membrane of the cochlear organ in the cochlear interior side. This is the ear drawing. Okay, now move on to taste. It's a chemical sense. It's called gustation when we eat. So food molecules will stimulate thousands of molecules in our mouth receptors. So our taste buds will line the papillae walls. They are the bumps on our tongue. Taste buds. And give us a sensation of taste. And that's about taste. Then smell is called olfaction for our nose. Then the interesting thing about olfaction is that the receptor cells are neurons in the mucous membrane of the upper nasal passage, and the receptor cells will send signals to receptor bulbs. They are above the sinus cavity, below the frontal lobes, receiving information directly from receptor cells. So smell goes directly to the brain for processing under the receptor bulbs, olfactory bulbs. Okay, that's about nose. Then Somastatic senses are our skin. They give us the ability to feel touch, pressure, temperature, and pain. Then somatic sense can also consist of proprioceptive sense, where we know where our body is in space. Then kinesthetic sense. Kinesthetic means body's movement and position in space. And vestibular sense, which is our ears' uh, ability to sense where we are, uh, which I'll explain. So there's a gate control theory that says that pain is experienced, uh, and this experience depends on whether neural impulses pass through a gate in the spinal cord that leads to the brain. So it's trying to say that when neural impulses can pass through a gate, then it will send pain signal to our brain for processing. If it doesn't pass through that gate, then we don't experience pain. So, okay, then I'll explain kinesthetic and vestibular difference. Kinesthetic receptors are our muscles, tendons, and joints. They give us our body's movement and position in space. Vestibular also is also similar, but it's due to the ear. So it's different. So it gives us movement, balance, and body position. But the sense organ is the ear's vestibular organs, which is the otolith and semicircular vestibular organ. So in sensory conflict theory, which is motion sickness happens due to information from the eyes conflicting with the vestibular's information. So for example, I'm taking a bus. Let's say I have okay, so let's say I'm spinning. Honestly, I'm not taking a bus. I'm spinning. I'm spinning, going around in circles. So let's say I suddenly stop. But because I have the liquid in the ear, it's still spinning, so it can cause uh, a confusion where I actually stop. My eyes tell me that I've stopped moving already, but in the ear it's still sensing spinning. So this can cause a different in confusion to the brain. So in the example of taking a bus is when I have stopped moving, but but my ears but my ears okay, never mind. I will share that another time. Uh yeah. Okay, so this is on the anatomical part of the brain. Um Perhaps if I have time, I'll share about the brain's thinking and cognitive processing in another video. Thank you for listening.